Gonorrhea is caused by bacteria spread from one infected person to another during sex. It can infect the urethra in a man's penis, the cervix in a woman's vagina, and the rectum and throat. Gonorrhea is a sexually transmitted bacterial infection that, if untreated, may cause infertility. Gonorrhea, colloquially known as the clap, is a sexually transmitted infection, STI, caused by the bacterium Neisseria gonorrhea. Infection may involve the genitals, mouth, and short rectum. Infected men may experience pain or burning with urination, discharge from the penis, or testicular pain. Infected women may experience burning with urination, vaginal discharge, vaginal bleeding between periods, or pelvic pain. Complications in women include pelvic inflammatory disease, and in men include inflammation of the epididymis. Many of those infected, however, have no symptoms. If untreated, gonorrhea can spread to joints or heart valves. Gonorrhea is spread through sexual contact with an infected person. This includes oral, anal, and vaginal sex. It can also spread from a mother to a child during birth. Diagnosis is by testing the urine, urethra in males, or cervix in females. Testing all women who are sexually active and less than 25 years of age each year, as well as those with new sexual partners, is recommended. The same recommendation applies in men who have sex with men. MSM. Regular screening can help detect instances when an infection is present despite having no symptoms. In men, the disease may cause burning during urination and discharge drip from the penis. Women often have no symptoms at all and may not know they are infected unless the disease is found during examination. Gonorrhea can be prevented with the use of condoms, having sex with only one person who is uninfected, and by not having sex. Treatment is usually with ceftriaxone by injection and azithromycin by mouth. Resistance has developed to many previously used antibiotics, and higher doses of ceftriaxone are occasionally required. Retesting is recommended 3 months after treatment. Sexual partners from the last 2 months should also be treated. Signs and symptoms. Gonorrhea infections of mucosal membranes can cause swelling, itching, pain, and the formation of pus. The time from exposure to symptoms is usually between 2 and 14 days, with most symptoms appearing between 4 and 6 days after infection, if they appear at all. Both men and women with infections of the throat may experience a sore throat, though such infection does not produce symptoms in 90% of cases. Other symptoms may include swollen lymph nodes around the neck. Either sex can become infected in the eyes or rectum if these tissues are exposed to the bacterium. Women. Half of women with gonorrhea are asymptomatic, but the other half experience vaginal discharge, lower abdominal pain, or pain with sexual intercourse associated with inflammation of the uterine cervix. Common medical complications of untreated gonorrhea in women include pelvic inflammatory disease, which can cause scars to the fallopian tubes and result in later ectopic pregnancy among those women who become pregnant. Men. Most infected men with symptoms have inflammation of the penile urethra associated with a burning sensation during urination and discharge from the penis. In men, discharge with or without burning occurs in half of all cases and is the most common symptom of the infection. This pain is caused by a narrowing and stiffening of the urethral lumen. The most common medical complication of gonorrhea in men is inflammation of the epididymis. Gonorrhea is also associated with increased risk of prostate cancer. Infants. An infant with gonorrhea of the eyes, if not treated, gonococcal ophthalmia neonatorum, will develop in 28% of infants born to women with gonorrhea. Cause. Gonorrhea is caused by the bacterium Neisseria gonorrhea. Previous infection does not confer immunity. A person who has been infected can become infected again by exposure to someone who is infected. Infected persons may be able to infect others repeatedly without having any signs or symptoms of their own. Spread. The infection is usually spread from one person to another through vaginal, oral, or anal sex. Men have a 20% risk of getting the infection from a single act of vaginal intercourse with an infected woman. The risk for men that have sex with men MSM is higher. Active MSM may get a penile infection, while passive MSM may get anorectal gonorrhea. Women have a 60 to 80% risk of getting the infection from a single act of vaginal intercourse with an infected man. A mother may transmit gonorrhea to her newborn during childbirth. When affecting the infant's eyes, it is referred to as ophthalmia neonatorum. It may be able to spread through the objects contaminated with body fluid from an infected person. The bacteria typically does not survive long outside the body, typically dying within minutes to hours. Diagnosis. Traditionally, gonorrhea was diagnosed with gram stain and culture. However, newer polymerase chain reaction PCR-based testing methods are becoming more common. In those failing initial treatment, culture should be done to determine sensitivity to antibiotics. Prevention. As with most sexually transmitted diseases, the risk of infection can be reduced significantly by the correct use of condoms and can be removed almost entirely by limiting sexual activities to a mutually monogamous relationship with an uninfected person. Treatment. Antibiotics. Penicillin entered mass production in 1944 and revolutionized the treatment of several venereal diseases. Antibiotics are used to treat gonorrhea infections.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.